Recently, I saw a young patient with rectal cancer in clinic who had been to 3 other specialists who had recommended 3 different lines of treatment. Now, what would be the reason behind this be? Is it because there are genuinely 3 different ways a particular disease can be treated? Or is it because the clinicians are not well versed with the latest guidelines and do not know how to treat a particular condition? Or are there any other biases which result in different treatment opinions? Hi, this is Dr. Chintamani Godbole. I am a surgeon specializing in treatment of colorectal cancer. And in this video, I would like to discuss the importance of MDT or multidisciplinary meetings in approaching complex diseases like cancer. Now, in most developed countries, whenever a patient presents with rectal cancer, the management of the patient is discussed in a MDT meeting, or what can also be called a tumor board, in which all the specialities which treat this condition come together. They discuss that particular patient in detail and then come up with a treatment plan which is suitable for the patient based on the stage of the disease and taking into account other patient related issues like the general health, comorbidities, etc. In this way, every specialist can contribute towards management of the patient, and you can avoid creating a messy situation where every specialist individually gives his or her opinion and the patient is utterly confused and not knowing what to do. Modern medicine is very complex and there is new evidence and new research happening every day. It is impossible for one specialist to be updated or abreast with the developments happening in the rest of the fields. This is the whole idea behind doing an MDT, wherein the specialist will give opinion with regards to his or her own specialty, but leave the decisions related to other treatment modalities to their respective specialists. So then what can be done in India to make sure that MDTs or tumor boards indeed take place in all hospitals which treat cancer, to make sure that the patients receive the right opinion for management of their condition? I think the most important first step that we all can do is create awareness. If the general population or patients suffering from the disease know that something like an MDT exists, then they can ask the clinician or the hospital that they go to that, have you considered opinion of other specialists which are likely to play a part in my treatment? Is there something like a structured MDT? Is there a documentation of this MDT with regards to when it happened and what was discussed? And can the patient or the relations see this form of documentation? Only when the push comes from the patient's side, the hospitals and clinicians will be forced to embark upon this journey, which I think is a win-win situation for everyone. There also has been some criticism of the MDT approach. The main one being that great time is lost in getting all specialists together so that they can come up with a decision when sometimes the decision making is straightforward. In my opinion, that is just a way to shun away from our own responsibilities. If we have to treat patients correctly, it is our responsibility that we find time, get together, discuss, and come up with a treatment plan which is both evidence-based and suitable for that particular patient. Thank you for watching this video. If you like the content, please subscribe to my channel.